The Libyan Digest.
The Libyan Digest is brought to you by the Libyan Observer.
Hello and welcome everyone to the second episode of the Libyan Digest. The Libyan Digest, of course, is brought to you by the Libyan Observer.
Hello and welcome everyone. This is Aisha, Shaka and Abduljalil. The Libyan Digest is brought to you by the Libyan Observer. As the last episode, today's episode will have another subject, another topic to talk about, issues to discuss, and of course we're gonna have guests.
As you have mentioned today, we have another topic. Today we are going to talk about the role of civil society, and NGOs in general, especially in the case we have a lot of issues to discuss about this topic. Regarding the coronavirus, regarding the war we have in Libya. So this is the main points we are going to talk about.
In Libyan Digest, we're going to discuss the COVID-19 or corona or this pandemic from all aspects, from the people themselves, the doctors, the specialists, and of course, as today, activists of the society, people who are trying to do something, and I think they are doing something.
Yes.
Okay. There are a lot of associations in Libya. They are active now. They are trying to deliver messages to people, try to make people aware of what we are facing. In Misrata there is the Libyan Medical Students and Young Doctors Associations, which today will be having one of their members, and in the society itself there are a lot of activists who just would rush into voluntary work and try to be there. Therefore, we would like today to have them, discuss with them, know what is really going on in the society, in the street. Are the people really aware of what we're facing? Is what we're facing is that dangerous? Should we panic that much, or just go with the flow and follow the rules themselves?
Why do we have to talk about civil society? We do actually want to talk about this case because of the delay we are seeing from the government. We are seeing a lot of things that doesn't going well regarding the procedures of the government. So I think these positive movements of the civil society are doing well, actually.
That's the good thing about this is what I like about the non-governmental associations, that they reach people themselves. They reach people in person. They do not have to go through procedures and all that. No, they reach people in person itself. Yes. Before we go deeply into this topic and to our guests, it's just that we want to talk a little bit about the situation of Tripoli. I hope that everyone is at home and they are safe. We're in critical situation of what the country is going through, facing the pandemic, facing the COVID-19, and of course the safety situation is being critical to them. We're telling them to stay home, However, if they stay home, they might face, I don't know, missiles, face danger. So our prayers go to them, and I hope they are safe, and may God bless them, inshallah.
Yes, before starting our discussion for today, let's have some news about the latest updates about COVID-19 and what is happening really in Libya. The first news is the deputy head of the sub-delegation of the International Committee of the Red Cross in Tripoli has said that a number of displaced families had to return to their homes in areas of clashes due to the coronavirus epidemic. The Red Cross official said that the IDPs told them that they had no choice but to return to their homes located in areas where confrontations are still ongoing. The National Center for Disease Control has said that another COVID-19 patient has recovered after testing negative on Sunday, bringing the number of recovered COVID-19 patients in Libya to 9. So this is a general overview about our discussion for today. Yes, let's welcome our guests for today. Yes.
Okay. Today we have fresh medical graduate and the general member of Libyan Medical Student and Young Doctors Association, Mr. Bakr Abdul-Malik. And of course, an active member of the society, Mr. Al-Harat Al-Shibani. Hello and welcome.
Hello.
Hello. It's a pleasure to have you today.
Yeah, for sure. It's our pleasure as well.
We're pleased to be here. Yep.
Okay. We're going to have you one by one, like many questions we have for you, and we hope that we have a great discussion. Okay. First of all, Mr. Abdul-Malik, Abu Bakr. Okay, Abu Bakr. You're a general member of the Libyan Medical Student and Young Doctor Association. Okay. Can you tell me about it? What is it? How did you start? What are you doing? Who are you?
Well, first of all, thank you for having me here. It is in those great and critical times that we're going through, and I really appreciate the efforts that you guys are putting through. And it is, as a member of the medical community as well, I should say that we are wrestling with challenging times on an international and a national scale. And as a member of the medical community,
yes,
I should be privileged to play a central role in this, in confronting this pandemic of the coronavirus that we're going through. It is not easy what we're going through here in Libya, given that we've sort of tackled on both ends, one with a critical health issue being the pandemic, and also the ongoing political turmoil and civil war that's going on currently. As you said, I'm a member of the Libyan Medical and Young Doctors Association. This is a non-governmental organization, an NGO, that was founded back in 2002 in Misrata. And might I add that this is one of the many offices that they have across Libya. Mm-hmm. I believe the very first office was founded in Benghazi prior to 2002, and Misrata was second to follow. And then from there, basically, it flourished all over different parts of our country. The main offices remain to be Benghazi, Misrata, and Tripoli. It is also a member of the International Federation of Medical Students Association. So there's this basically huge non-governmental organization known as the International Federation of Medical Students Association, IFMSA for short. and that organization is basically just a conglomerate of different associations like LMSAA that are being represented on on an international level. And IFMSA has more than 133 associations all across the globe, just like ours, and is basically just works as a network between different associations. So we're not only working locally, but we also do have some international relations with like-minded and mutual organizations. Among the things that we really sort of interested in, and the things that we offer to our community is through one of our committees, which is this known as COF, which is the Standing Committee on Public Health. So to put things in perspective, in this committee, what we do is we sort of try to raise awareness about different diseases and things like that to our Libyan community and our Libyan population, which I have to say they are a bit lacking in terms of medical awareness, and that is our duty as medical students and as medical professionals. Also, we have other fronts that we're servicing to the country, to our community, being a committee known as SCORP, which is Standing Committee on Rights, Human Rights, and Peace. Also, SCOM, which is Standing Committee on Medical Education. So that committee is dedicated to providing medical students within our faculty or different faculties from other universities across Libya, sort of giving them the opportunity to become more competent doctors, to become better physicians, better leaders in the health community once they graduate and things like that. So they empower them with a lot of medical education. They sort of enrich their medical minds and their medical skills. They try to cultivate that as well. So that's one aspect of the Standing Committee. Also, we have SCORA, which is Standing Committee on Reproductive Health and AIDS. So that is a very global issue that's happening right now, and that's something that we also advocate for. We also have SCORE, which is Standing Committee on Research Exchange. So that's one of the arms that we have, which is we offer exchange opportunities for medical students with the IFMSA to do research across different countries. So to put things again in perspective, what we do is we exchange students from different countries or different cities to do research in Masrata, and vice versa, where Masratians go to different cities or countries and conduct research during their summertime or during their breaks in between years and things like that. So again, it really just sort of caters to empowering and producing competent medical students, and also serving our community in terms of health and in terms of promoting a very healthy lifestyle and a mindset and things like that. Might I add one last note that we are the only organization that is dedicated to empowering medical students as well as the community. I understand that there are other organizations where they're committed to the community, but we sort of tackle both fronts, the medical community itself and also the medical students themselves, because they're the ones who are going to serve their community from a health perspective.
Mr. Al-Harat, yes. Your evaluation about the activities that the civil society is doing right now, especially facing the coronavirus pandemic.
Well, first of all, I would like to greet everybody listening through his house, through his phone, or in his house, in his car, through any electronic device. I'm sure these moments of the Libyan society, we are facing quite a lot of struggles, I would say.
Yes.
Including the pandemic, as he said, and the conflict. I would like to thank Mr. Bakr for all his information on the NGO, which I believe it has a burden, and the burden it's quite huge, especially at this moment. And when identifying all these, I would say, responsibilities that the NGO has took on her shoulder. I hope that you succeed in everything that you do, and all the best.
Yes.
In terms of the civil society, me personally, I'm a member of a number of civil society organizations. For this opportunity, I would love to not to name them. The reason why, because being an activist, I want to prove to all those who are listening that you can include yourself in more than one NGO. You can include yourself in more than one campaign. You can have this habit of working towards your community. And it doesn't matter who you work with, it doesn't matter who you are with,
Yes.
and it matters of your interest and the aim that you're trying to reach for. Looking at the civil society in general spectrum across, especially my city, since the start of the pandemic itself, and even before it was spread here, I was very happy and also surprised with the amount of hours that many youth has managed to give, especially voluntarily speaking, to give to take action against this pandemic. Some was, I would say, it was in a way organized, and some it was not organized. In some campaigns, I believe, that's some of the youth, for example, the campaign for that was to intervene in, going through different hospitals and going to through streets and trying to spray them with all this liquid and try to basically, I would say, I forgot the medical term of it, to try to eliminate all the virus, across specific buildings. And this has started from youth, and then the youth tried to push towards getting other organizations, I would say governmental organizations and services, to be able to provide them with material, resources, vehicles, and even liquid to start work. But the initial fire that has caused all of this, I would say, scene, it was from the youth. And it's very proud, to see such thing, especially in my city. And in comparison to other cities, of course, we support all the other cities around Libya.
Of course, yeah.
But seeing the push, it's we are competing towards a good cause.
Yeah.
And it's something that we are proud of. And we can have an example for many other campaigns. We have campaigns, for example, to feed those who can't afford to buy food. And those workers who depend on the migrants who are standing and waiting at the roundabouts and trying to get something to eat, daily speaking.
Yeah.
And again, there's many more examples. You're talking about many businessmen trying to give to these youth some resources to try to push them, because at the end of the day they have that free time and they have that will to be able to give. And the third part, where we're trying to see NGOs themselves trying to interact and trying to organize themselves together to try to produce something, which is, I think at this moment it's very good, and especially because I think medical NGOs are the most important ones to be considered, especially at this critical moment, due to the prevention measures that we need to take into consideration.
Yes. Before starting our podcast, we have talked about NGOs and civil society, and one of you said that there are no different between them. So what do you think about this?
My take on this is I feel that they're very synonymous, so they're interchangeable. If you say a non-governmental organization, you'd be referring to also a civil society organization. Maybe a bit of the differences could be the funding, maybe. I'm not 100% sure. But again, those are very interchangeable terms. They're used very frequently as NGOs or CSOs, civil society organizations. So, but again, they're both there for the community. And what they try to do is provide humanitarian and also social support to the community. So regardless of what term an organization refers or labels itself with, they still sort of end up at the same point. They sort of are there for the people and they're by the
same
people.
goal.
Exactly.
So we are talking about the aim of these associations. In terms of both of them have the same
they
goal.
serve the community itself. Another thing that we have to highlight for the youth. You don't need to wait for an organization or association to work. You just work, have a team. I do that sometimes. Like I look for work to do and like have people to help me, and I just go for it. Voluntary work is very important in the society. Start as a volunteer, then just serve the community.
Yes, I think I will add to this point. As I said, when we speak about the civil society, I agree with what Mr. Bakr has said regarding the NGO and the difference between civil society and NGOs. Well, it's underneath the civil society. The NGO itself, it's underneath the civil society umbrella. And within the civil society umbrella as well, we have the campaigns. And across the city, there's many campaigns. Some of them will last for 2-3 days. Some of them will last for a couple of years.
Yes.
And the thing that we need to understand, these campaigns are based on the interest and the will of those who are working within the campaign itself. So, as Mrs. Aisha said, when you have the will,
Yes.
and you want to do something, and you find a place that houses this will and houses this energy and translates this energy towards work, towards like goals and towards a vision, and you find it just works, it serves the moment. And so far we're doing a great job in terms of like creating incubators to be able to actually house different energies from youth. Some people can help within hospitals, some people can help within the streets, some people can help through online like participation and awareness raising. And for example, as well, we have some of the schools now have started to push towards. I don't like to speak about myself a lot, but sometimes, for example, when the coronavirus has happened, the spread itself, I tried my best to see where I can be involved in, and sometimes I take decisions where I use my contact. And I push people from different sides where I can see there's an opportunity for other people to interact with each other. And when you see an idea being implemented and you had this idea, like for example 2 weeks ago, 3 weeks ago, and you pushed other actors to do this idea. Obviously, I'm not saying this because I want to be like saying that it was my idea, but it's that we have a will to do good. And we are helping each other, being supportive as one team to fight this pandemic and be able to eliminate it by creating many solutions, and such as the introduction of the online workshops. I know Mr. Muhammad Shibani, he's probably listening to this now, so I say hi to him and hi to everybody who knows him. Shout out, as they say, yeah? So when he was doing the workshop, he was one of the people who has pushed me towards doing another workshop, which I call the Al-Harat Al-Shibani, as they say in Arabic. And it's something that I did. I translated my will to help, and also the will to be able to help those who are like they have free time, to use this free time to help them, maybe in person, maybe within a group. And because we see each other pushing towards a great end, you see, without Muhammad, for example, I would never be able to actually push myself, and maybe someone else will see me doing something else and he will be pushed towards the same thing. And when you see, like for example, the medical organizations working on like doing many great things within the hospitals and trying to raise awareness across, you start seeing yourself, and how can I, meet this, in my perspective, in my subject area, in my area of benefit to the community. And this is the content, I would say.
Yes, you have something to say.
Yeah, so it is great to have people like Mr. Harith to sort of help direct the youth, right? We said we have a bountiful amount of untapped youth, meaning that they don't have, they have potential, but they don't know where to go. So having someone like Mr. Harith to sort of direct them to sort of use their best abilities to help serve the community in such circumstances and predicaments that we're going through right now is fantastic. And like you referred to, Mr. Muhammad Shibani has also been doing a great tremendous amount of work towards having people ease off the whole corona thing.
Yeah.
Referring back to Mr. Amin's NGO versus CSO, civil society organizations. Again, there isn't that much of a difference, but in current conditions, in this pandemic, every NGO sort of is putting its best skill set out there. So it's like this big pot where every NGO tries to put its best resources that it has from whichever aspect they come from whichever background they're from, whichever expertise that they have. But they become innovative, and they try to innovate ways to help the pandemic in any kind of way, even if it's just sort of mass social media awareness. If that be it, then they're already doing a very good job, and they're already putting to this cause.
I want to add to this as well in terms of coordination speaking. It's something that we could use even in future speaking. Like, although we have one aim and target is to eliminate this COVID-19.
Yes.
But maybe in future we be able to actually coordinate together as NGOs to start working on things which are continuous. So, for example, let's say like poor facilities, poor hospital facilities. Maybe it's something that the medical NGOs can start collaborating together and start identifying the needs across all of Libya, for example. And I would say the same thing with other NGOs which are considered in terms of like, for example, the debating, association, like such as the DDA, or well, let's say the H2O in Tripoli, and like they try to like work together to start identifying areas of improvement. And let's say one organization will have a specific project that is specifically in one city. Why don't they just give the same model to the other city? And instead of saying, okay, this is mine, I did this, let's try to be more open. At the end of the day, it's like what the Toyota company does to other companies, around the world. If you read the Toyota Way book, and also if you understand what the philosophy behind the Toyota company, it's when they discover new technology, usually what they do, they send their own technicians to other companies around the world, or company cars, to help them like learn the same technology that they have discovered. Why? Because they believe on teaching others what they have learned, because this is like somehow they are improving. When you improve the whole platform, it's like the USB port. If you understand that the USB ports, the majority of phone companies have the similar USB ports, and the majority of USB chargers and USB ports are same as well. Even laptops now and like tabs and everything. Similar. So you are actually saving a lot of material, saving a lot of time and waste to actually help establish the goal that you want. It's same thing with the civil society. You have areas that you need to improve within the community. I believe that these areas will never be filled, and there always will continuously be. You always need to be intervening within this area. For example, poverty, lack of food, lack of shelter, and development. Youth development, and probably like job opportunities, and education. And studying in general, there's always an area to improve in civil society. And that's my main point.
Actually, civil society or volunteer works is a culture, and I think, in my personal opinion, I think everyone is responsible for spreading this culture. So that's what I think Mr. Had is trying to say.
Yeah.
Yes, do you have one?
I want to go back a bit to the LMSA, Libyan Medical Students and Young Doctors Association, okay? It's just that...
Yep.
finally. It's just that I want to highlight the work you do, okay? First of all, like, I'd like to thank you for the good work you do. And also because let's say the medical side is underrated in Libya, let's say. Somehow is underrated, okay? From like the point of view that I see here, it's considered that way. I want to know your current work about the COVID-19. What are you doing now? What's your work for the COVID-19? And is it here just in the city, or is it around Libya?
Yeah, I'm sure I'm happy to sort of talk about our works and efforts that we've been putting forth. Definitely, we are a medical related organization, so we've definitely have been everything but silent with regards to the pandemic. Might I add that we've been the very first group to actually speak about this publicly and sort of advocate for it and raise a lot of awareness for it. So going back to the point that you said that it is underrated, I feel just like that this current situation, because being a health crisis or something that's related to the medical institutions, it sort of highlighted how weak, I would have to say, or for lack of a better term, feeble our healthcare system is. And as other organizations or governmental institutions in our country, they are lacking, they are short-handed, they're not really operating at a wanted standard, but just given the context of the situation that we're in right now, this just highlighted how our healthcare system is weak. So what we've done as the LMSA is we initiated the awareness campaign for the people that are traveling and coming from abroad. So at the very beginning, first week of February, specifically, I think somewhere around the 3rd or 2nd of February, what we did is we tried to raise awareness about the corona situation by educating people that are leaving Misrata or Libya from the Misrata International Airport to wherever they might be going. So what we try to do is give them a little bit of tips, what they should be looking for, what should they do, what are the precautions they should carry out. Again, our Libyan community is still lacking in terms of medical knowledge and medical awareness. And one of the problems that we're facing with corona is the novelty of it. This is something kind of novel to the Libyan people. They haven't had outbreaks before, and they don't know how to deal with this. And might I add, even some healthcare professionals don't really know how to deal with this, how to deal with simple outbreaks, yet alone this outbreak. So,
sorry for interruption, and I think this is an important point. COVID-19 is something ignorant for a lot of people around the world, not just in Libya. The problem that you have faced personally about explaining what COVID-19, the symptoms and other stuff maybe.
This is very true, given that the coronavirus is novel, but the principle of outbreaks and epidemics and pandemics is very settled in the minds of other nations. I believe other nations have witnessed different types of outbreaks and have suffered through different epidemics. So the public are a bit conscious of what to look for. They understand what an outbreak is. And aside from them understanding or having a bit of medical background to what outbreaks are and what to do in the times of outbreaks, they are also health conscious as compared to the Libyan community that we're dealing with. So when we first hit the airport, the Misrata International Airport, and we tried to educate people, there were a lot of people that did not know what to expect, what's going on, what is even corona to begin with. Because again, we said we were the first ever to be there. We were at the very beginning of this situation, and we went straight to the airport, where we think that was the main point where we should focus our efforts on. This of course dates back to before diagnosing any corona or COVID-19 cases in Libya. So we thought that the airport was a very critical place for us to educate the people. So what we did is we placed the team in the arrival hall and also in the departure hall. So before people take off and board their airplanes, what we would do is give them pamphlets, give them brochures, educate them a little bit, and even at times we did hand out a little bit of hand sanitizers, face masks, and things like that. But we just wanted people that are leaving the country to take a bit of contact precautions. And then we did the same thing to the people that were arriving from from abroad, from wherever country they were coming from, especially from high-risk countries at that point in time. So what we did is we also educated them. We gave them pamphlets, we gave them brochures, and we also talked to them about what symptoms they should expect and that they should seek medical attention right after. So that was our main sort of idea, and that was the effort that we were putting there. And we lasted a very long time in the airport, and might I add, we have not missed any flight takeoff or any flight arrival. Every single passenger that was taking off was catered to, and every patient that arrived was also catered to. So kudos to those at the and my colleagues and my fellows at the LMSA for day in and day out being there for the public.
Yes, about the current stats we have in Misrata and in Libya, and the activities that your association is doing. The current status, how can you evaluate the cases we have, the recovered cases, and yes.
Yeah, definitely. So again, like I said, right from the first week of February up until the 16th of March, that was the end of our journey with the airport, because in March 16th, our Prime Minister mandated that there be a full border lockdown and there were no flights to leave the country or come in through the country. So our journey with that ended, but that was just us getting started, because what we did after that is we started going to different institutions. So, for example, the telecommunications company, the Libya Telecommunications and Technology Institute that's responsible for the internet and things like that. We went and when we tried to raise awareness about this and educate a little bit different institutions as to how to react, how to take precautions. Again, like I said, our our community has very limited information about how to deal with outbreaks and what exactly do you mean by contact precautions, when to do this, when to do that, how to practice social distancing, things like that. So, and how to sort of operate in the context of this circumstance in your workplace, right? So that's why we went to different institutions. We even went to prison places, rehabilitation institutions. We went to a bunch of places, and we've had a workshop team go to each institution that we could reach to and sort of provide them with that. One big input that we did was initiate the call center. We at one point said that talking directly to people was not sort of with the aims of staying at home and practicing social distancing.
Yeah.
So and this was also taken from different countries that have done this, is initiated at the call center, and they've implemented that. So the LMSA took the initiative to start off the call center.
Yes.
And what we did is we liaised with different medical authorities. So we're talking like the National Center for Disease Control and Prevention, for short NCDC, also the WHO branch in Misrata. We sort of liaised with them to have us take care of the call center, because it doesn't really take that much of medical profession, and you need as much sort of number of medically aware personnel to run the call center. So what better to be than medical students? And our medical students have been fantastic, and I've been more than happy and open to actually come and talk to people in the call center. So again, the call center was a huge step that we took to sort of help social distancing. If you're sick, you don't really have to immediately go to the hospital unless it is a very, very dire emergency. But again, if you're sick, just call the number. You don't have to go to the hospital or anything like that. And we not only sort of attended to symptoms and medical issues and things like that are related to the corona, but also just putting people's minds at ease and also giving them precautions through the phone and through those call centers. Like, some people don't know how to act, how to do, again, the people that we could not reach to through workshop institutions or the social media. They could call the number and they could get updated guidance and instructions on how to do precautions and how to do everything. So the call center was a huge step, and I'm proud to sort of talk about this. Yes.
Actually, the call center was like a great step, and it was spread all over social media. Like, people were sharing it, giving it to everyone. People have it screenshotted. I did screenshot it, by the way.
So did I, by the way.
Of course, we have to be very careful. This question is for both of you, okay? Since you were both in civil society, and since we have many foreigner listeners, foreigner workers listening to us, we want to know: are there any like works to help foreigners here? Because we know a lot of them are unemployed at the moment. Some maybe have their payment daily, now they don't have any. Are there anything that has been done towards them, or are there any plans to do it?
Even Libyan people, some of them are
Some of them
the same case, I think.
I guess.
I think both of us will have an input on this, I'm sure, but I'll briefly just explain from my side what I have seen. There's probably more into it, but I understand there is a campaign called Aoun, for example, that is just recently has started, and it's focused mainly on people who are from other countries. I would say those who are unfortunately vulnerable, and as you said, they only have like their day-to-day job, to provide them with all the essentials, and the campaign itself is doing a great job because they are monitoring as well some compounds and some areas where they're trying to intervene as much as they can. And honestly speaking, it's a burden, and it's a huge burden to take on one campaign. And I would say there are unofficial campaigns as well outside the civil society official umbrella. But at the end of the day, if we want to class it as an unofficial umbrella, I would say we have people from the community. I was surprised one time while I was going with one of the campaigns, while we were going to one of the compounds, we discovered another, before us there were people already have given them food. So when we just said hi, assalamu alaikum, how you doing, what are you doing, they said we are just people from the neighborhood. We gathered them some food, and some essentials, and we don't want them to die from hunger, and it's something, honestly speaking, as Libyans, we need to be proud of,
100%.
Some people I've seen some Libyans saying, oh, you need to look at Canada, you need to look at the US, you need to look at the UK. I mean, each country has its own cultures,
Yes.
and because we are in Libyans, and we know that we can help each other, even though we have
Conflict.
other challenges, I'd say, such as the conflict, and people are dying every day, it's very unfortunate. But this is to show to others around the world our core, personality, that we are Libyans, we are humans, we are peaceful, we love to help others, and once we get the opportunity to do so, we always are. We have the open arm, as they say, and we give. That's in terms of like the campaign itself. Looking at maybe I would say the daily work, I understand that some of the shopkeepers as well, they are providing for their workers as well, and they're telling them to, for example, to stay at home, stay in your compound. I'll bring you food. I try to bring you a monthly salary. Some of the workers have been paid half of the salary, and there are many like few images that we did good, I'd say, but we still need to push ourselves more for sure.
Yes.
Yeah, definitely. I share the same thoughts on this as Mr. Harith. Definitely, there are some unannounced efforts going on currently. There are some good Samaritans, good citizens in Masrata that are doing personal efforts to try to provide some sort of food, any sort of financial aid or any financial support, might it be small or big, to those foreigners. So looking at this really speaks volumes to what the Libyan people are principled upon and what are their values are. Because again, amidst all that we're going through, which is not at all easy to be going through, to see things like that is very profound. But then there is some highlighted work that we've seen, like Mr. Harith said, Aoun. There are also some of the foreigners that do not sort of work work in a skilled trade where they are paid on a daily basis, but are paid wages. And I've heard a lot of the shop owners or their employers have kept their salaries consistent, regardless of the work being done or not amidst those times. So that's also a very good thing that's going on. So I commend those employers and those business owners that are still keeping that money going for, or those salaries happening for those foreigners. So again, amidst all of those, all the things that are happening, this is something that we really should cater to and sort of pay a little bit of attention towards.
I just want to take this moment to ask the doctor here, fresh doctor, I'd say,
yes, go ahead.
To maybe like give them like a very brief advice, maybe even in terms of like our editors could like cut this bit and share it, you know, because if it's an hour, some people don't like to watch like a whole program for an hour. Maybe it's for like 1 minute, so we can use it. Say, for example, what are the prevention measures that those people who are living together in a very like close, you know, compounds, and also let's say like they are like, for example, like using showers together, you know, one toilet and all of this. Like, what's like just try to be as brief, as simple as you can be, because some of them might be able to actually understand and help you train them, you know, like within the compounds.
Definitely, it'd be my pleasure to sort of put some thought into this. Again, one of the main and the focal strategy that we have here is social distancing. And with outbreaks, one of the things that we're as in the medical community that we're very worrisome of and we're very worried about is the sort of the overcrowding. And again, those foreigners and those skilled traders, they sort of live in compounds where they're basically compacted together into one small premise.
Just to add, you know, some of them live in each room 25.
Yep.
25 people.
So
in like 3 meters by 3 meters, yeah?
It is actually very concerning in terms of outbreaks, because if that corona hits there, then boom, you've got yourself a room full of 25 people, like you said, already have contracted the disease. One thing that they could do is sort of isolating a group is also something good. So as long as no one sort of does any outside contact or does not frequently contact someone from the outside and sort of brings it in, and then from there it sort of infests into the other housemates or people, the foreigners that are living together. So this is one thing. So if they could sort of isolate themselves as a group, it's still considered as one person that could not transmit the disease. So that's a very good tip. The other good tip, I understand it's very difficult to isolate yourself for a very long time. So make any errands or anything, any necessities that you need to get as few as possible. Limit those. And if you do, take the necessary contact precautions. Meaning, once you leave that dormitory or that place of residence, try to wash your hands before leaving. Once you leave, try to keep minimal contact in the shop or whatever that you're in. If you do see any crowding inside the place, do not enter. Try to seek a different location or a different shop that is less crowded. Try to go at off-peak hours, especially if the place is close to your vicinity, right? So this is also a good tip. So the contact precautions: wash your hands before you leave. Try to keep social distancing, meaning 2 meters apart. Don't go to a crowded shop. Wait until it's less crowded. Don't go there frequently. And once you head to your place of residence, the first thing that you do is leave all of your sort of detachable belongings outside. So we're not talking about like shirts and pants and things like that, but at least the jacket, shoes, and also your socks, keys. I see some of them wearing the visors, the sunglasses. To leave those out as well. And just use the hand sanitizer before you go in. And once you go in, go straight to the bathroom or the washroom and try to do the 30-second, preferably the 40-second hand wash. And finally, if they get any sort of symptoms, so the 4 main symptoms that you look at, fever is definitely one of them. If any of them gets feverish or anything like that. Also, a cough, whether it's dry or productive, that is of a concern. Also, any shortness of breath, and that feel of generalized weakness or lethargy or fatigue. Just contact our call center that LMSA has set up, and the phone numbers are 094-419-0506, 094-421-0506, and our third number is 094-423-0506. And also to any Good Samaritans and all of our NGOs out there that are listening to this, those people do need to be concerned too, and also try to provide them with any of the things that they need, which I don't believe is a lot. I guess it's just a bit of money and a bit of food to keep them sustained. Try to provide them with that to limit their interaction with the outside. Mm-hmm. Because they could possibly be will propagate this pandemic or epidemic, given that they're in a crowded place.
Thank you, Mr. Abu Bakr. That was really helpful, and I hope that our listeners follow the steps that you just mentioned. And of course, us as Libyan Digest will be sharing the numbers, quoting your the steps in the comments. Of course, for the people who are listening, if you know any good works are being done in the society, such as charity work for foreigner people, for Libyans, for anyone who's in need, please share it in the comments so people could contact you. If you have anything that can help people, please just comment at the Libyan Digest broadcasts.
Yes, I think...
just one last thing with regards to, like I said, there's unannounced efforts towards those foreigners. So one thing, surprisingly, that has been very helpful is that we've been receiving through the call center a lot of people that want to help but don't know where to go. So for all those people that want to help with this cause, they could definitely call the call center as well, not only if you have symptoms. Again, we said we cater to different things in the call center because this is like all hands on deck situation. So definitely they could call, and we could definitely sort of connect or link them up or sort of hook them up with whatever organization that could help them to the cause that they want to donate to, that they want to help with, which is securing those foreigners some food and money.
Thank you very much for all this I would say valuable information. One thing I would like to share, and I think it's very important for me to share this with all the listeners around Libya and around the world. You never know where and who is going to be listening to this. But a few steps I would say, like if you have some time, you just take a paper and pen and try to write these notes down. So how can you get involved in terms of like being an activist within the civil society, especially at this critical moment of the world? And it's when you have the will, you need to understand that there's a will for you to help. And firstly, you need to translate this will into your environment. Sometimes you are the only child, for example, in the family, and you have the will to help and engage with the society. But your mum and dad are more important than the society itself, because if you go outside to try to help the society, your mum and dad, there's nobody to help them. So you might just change the idea of helping the society just to stick with your mum and dad firstly. That's one thing. So you need to understand that you need to be aware of your environment, how to be able to actually have this, I would say, opportunity to go around. That's first one. When you have the will, you need to understand you have the will and check your environment. The second one is checking the online platforms and, Facebook, Twitter, and I'm sure in every city around the world, and also specifically in Misrata, we have all these like small little NGOs and campaigns and people that we know, and that we did this today, we did this, that, yesterday. You contact them and you try to understand where they are and who they are and how they're doing it and why they're doing it, Try to get as much information as you can, either by calling or visiting or contacting or chatting with anyone that you know. And then you identify that in comparison to the will that you have, in comparison to the experience and expertise that you have, how you can engage. So, for example, speaking about medical engagement, if I don't have a medical background, there's no point in me going engaging in hospitals, because I might cause problems,
Mm-hmm.
And that's very important. If you have logistics experience and you'll be able to actually support people with providing resources to the hospitals, maybe it's something that you need to do, but you need to be trained for. So you need to understand how you can add to these campaigns, I would say. And lastly is trying to engage and really help. And one thing I would say is for all of these people who are saying, "Oh, why would I actually engage?" Well, it's a win-win process. Yes, I would advise you to go and help them, the society, throughout the civil society. This will help increase your experience. This will also help you practice your skills that you have, also, and use the tools that you have. Getting to know people who are active. As we said, there's something called the neighboring effect, around the world. When people are engaged together and they are moving around and being active and seeing people completing things, and you're like, you know what, I want to be like him, I want to be like her, they are pushed towards a great goal.
They sort of rub off. Yeah, they rub off.
Yes, and so for example, when the COVID-19 is finished, you will have more experience, you have more people that you can contact, and you are engaged more with the civil society. And then the fourth one would be the result of all three, where you can be engaging with international trainings, international opportunities, international conferences. I mean, at the end of the day, yes, we would like to help the community, but also we would like to help ourselves. There's a win-win process here, and this is completely fine for us. And yes, and all of you that are listening, please try to help your community.
Yes.
Thank you.
So we have reached to the end.
Yes.
It was a pleasure indeed having you, Mr. Al-Harat, and also Bakr. Do you have something to add at the end?
It was
maybe a message, or
it was definitely my pleasure to sort of talk about the efforts that are happening and sort of raise any type of awareness that we could. Again, a lot of the people in the community think that healthcare providers or people in the medical community are the front lines of this, but believe me when I say we're the last line here. Believe me when I say the front line is you being at home and staying at home. I understand saying that medical healthcare professionals or healthcare providers are the front lines of this, and this sort of military terminology is apt here, but believe me when I say you guys are at the front lines by staying at home. And in this context, this is where heroism lies. Stay home and stay safe.
Yes. So yes,
I would
Mr.
like
Had.
to just to say thank you to Mr. Alamin and Mrs. Aisha for the privilege invitation.
Thank you.
And I thank also to Mr. Bakr for getting to know him more, I would say, in this moment of time. And thank you all listeners, and I really hope that you benefit from this conversation, and thank you for listening.
So yes, raising awareness, maybe empowering communities is the main goals that we have reached at the end of this second podcast of the Libyan Digest. Do you have something to add?
I just hope that our listeners got to know more about the civil society, the medical work of the students and doctors in Libya, and everyone just let's just say stay safe. I hope everyone is safe, and I think
Yes.
that's it for today for Libyan Digest.
Thank you for everyone who's going to listen to the second podcast of the Libyan Digest. Stay safe. Thank you. Goodbye.
Bye.
Thank you. The Libyan Digest.
The Libyan Digest is brought to you by the Libyan Observer.